to ensure that over 4 million young people in my country can have access to comprehensive sexuality education by also designing, thank you, by also designing a comprehensive sexuality education syllabus that will be taught in schools. You know, I led the actions with my team members, and it involved inviting government officials to sit at table, but the young people were actually at the head. We were not only young people, but young professionals. So it's about actively engaging them at all stages. Economically, I wouldn't like to end my statement without also talking as a professional. We should identify the niche of partnerships, and in the business model, we call that your target market. What is your target market, and what do you do that is different from what others do, lest we keep on repeating. And the set objectives as well. I think partnerships also should have some sort of a business model, which PMNCH has.
Thank you. So we need less table dressing and more effective engagement of not just young people, but the people that should really be on the table because they know what we are going to address. Comments, questions to Desmond? I'm quite sure that people are very excited about some of the work that you're doing, but some specific questions or comments? It can't be true, a whole room and nobody has a question. Yes, please.
Very much. The youth, most of the time they want to be engaged. But when it comes to the structure that needs to be followed so that they can be engaged constructively using a set procedure, you find out in some countries it's disjointed. Most of the times, some of them, they follow politicians, even where some of the decisions taken by politicians are not strategic to their welfare, as long as it suits their own personal selves, they get involved in that more than the national goal. In your country, how do you handle that situation?
So we see whether there are one more questions or comments. Yes. You can just pass the mic on there. Somebody's getting a bit of exercise here. That's good for health.
Okay, thank you so much. Desmond, you're so awesome. Thank you. And my contribution actually not a question in terms of sustaining and scaling up partnership with young people in this era of the SDG. I would like to contribute that just the drama that was acted up here is very strategic. Yeah. Maybe we need to start listening to young people, start working to them, and identify youth-led organizations that are doing amazing work. Then we should start supporting them, actually beyond getting them on the table. We need to get them on the table, beautiful, but we need to also work with them to actually reach their own constituency. Thank you so much.
Thank you so much. And the people we saw here on the floor were coming from the PMNCH, Adolescent and Youth Partnerships and Coalition. Desmond, a question about politics.
Yes, thank you to the gentleman who raised that. In fact, you helped me to round off my statement. Young people need to be organized. That is what makes you sell out. If you're not organized, I really appreciate what you say, because my debates are always objective. To the young people, I always also say, learn to be organized and to have good values. There is the notion that young people aren't organized and they lack the values to sit on tables and also take decisions. We have a few young people who can do that. And to the others, I would say, do likewise. You should have a structure. It also comes to training. And these two programs, Women Deliver Young Leaders Program, the AYC, they have incredible platforms. These young people can get enrolled and would go back with skills in budget, creating budgets, in framing projects, in leading them. But to the young people, advice from my 14 years of involvement in youth leadership. Actually, I started when I was very young. I wish to say this, that youth leadership is not rebellion. It is about robustness. It is not resentment, but it is resilience. And it is about engaging as much as you can. Do not also wait to be called. When you think you can also speak on such a platform, why not write the CEO of Women Deliver and say, I would like to talk in the Women Deliver conference. You are engaging and you are identifying yourself. Thank you.
Thank you. I think I know who you had dinner with just the evening.
Yep.
If we then move on, Claudia, you have been engaged in different partnerships, and one question is, of course, one can start partnerships, but how to ensure that we can sustain, we can ensure that this is actually leading to something long-term, and that we're getting some sort of more long-term impact from this. What are your reflections from your experiences?
Let me talk about the public-private partnership that I've been engaged with for the last 6 years, Saving Mothers, Giving Life. Saving Mothers was debuted at the Call to Action event in Washington in 2012. I'm sure there are many of you in this audience that were in attendance at that meeting. And the goal, the audacious goal that was put forth at that time was that Saving Mothers, or SMGL, would decrease maternal mortality by 50% in 1 year. You can imagine what those of us who have worked in maternal mortality for many years felt about that goal with a roll of the eye, and it soon became the aspirational goal that we were to try to attain in that time period. The idea was that we needed something that bold, that audacious to attract new actors to this element, that we needed that kind of a bold goal in order to re-energize the health and development community. And of course we needed that kind of a goal, that energy, so that we could bring in new resources. The representatives of the Saving Mothers, Giving Life partners, we had 6 U.S. government agencies. We had Merck, or Merck Sharp and Dohme for mothers, Every Mother Counts, which is an advocacy NGO. We had the American College of Obstetricians and Gynecologists, Project Cure, which procures donated hospital supplies and equipment. And we had the governments of Uganda, Zambia, and later on, we added Nigeria to that. These representatives from the partners formed the governing committee, which was called the Leadership Council. And a secretariat that was originally run by Merck for Mothers and then was handed off to USAID for the last 4 years, was in charge of execution of the initiative, along with working, of course, with the Ministries of Health in Uganda and in Zambia. The model that was used for this partnership was a district health system strengthening approach, and this approach aimed to reinforce the existing safety net provided by both public and private providers. So it was using what we call the total market approach, thinking that the ecosystem is made up not just of the public sphere or the private sphere, but together, working together. And this systems approach was meant to address the 3 main delays, the reason that women are put at particular peril at the time of their delivery. And those 3 major delays are the delay in seeking care, in reaching care, and then once at a facility, receiving medically appropriate quality care. The Saving Mothers, Giving Life theory of change added another dimension that I think is fairly unique to this partnership trying to address maternal mortality. And that was that SMGL worked to ensure that any woman in the SMGL catchment area, should she experience a complication, would have access to comprehensive emergency obstetric care within 2 hours. So all of these things lent a systems frame to what needed to be done to strengthen that ecosystem and keep women and newborns alive. Implementation ended in Uganda and Zambia after about 4.5 years of implementation in 2017. And we fielded a suite of evaluation studies. And these were undertaken to assess the outcomes, the processes, and the impact of what SMGL had been doing for those 4.5 years. And it included a census in Zambia and a reproductive age mortality study, a RAMO study in Uganda. The results from these gold standard population-based studies showed a 44% reduction in MMR across the 4 districts in Uganda and a 41% reduction in MMR across the 4 districts in Zambia. We had significant decreases in stillbirths, but we had non-significant findings for newborns, and if we had more time, we could discuss that. A qualitative study of the partnership was also undertaken, and I will wait to kind of report out on what some of the findings of that qualitative study were, which basically found that SMGL had been able, in many regards, not all regards, in many regards to surmount some of the pitfalls that we find very frequently in large public-private partnerships. So I will save that.
Thank you. Thank you very much. Good examples of effective partnerships, also with clear matrix that will show what you actually achieved. Thank you very much. I think we are a little bit constrained with time, not enormously, but still. So I will move on directly to Betsy. You are a very engaged civil society advocate. The importance of civil society, we heard it already from the minister, but could you give us a little bit more of why is that so important?
Yeah, thanks, Anders, and that was an amazing example from the minister, and maybe I'll just share a little bit of a kind of different angle. That was very much government leading with civil society partnership, but also talking about where civil society really plays a role in facilitating partnerships, particularly in that bridge between engaging citizens and then ensuring the political response. The way White Ribbon Alliance works in any given country is partners get together to identify what the key priorities are to work on, and by nature of the alliance, it's a whole host of different partners that get around the table to identify the key issues, the strategies, and then to carry them out together. A couple of years ago in Pakistan, the issue that White Ribbon Alliance decided to take on was anemia. Recognizing that 60% of women in Sindh province have anemia, which is a major contribution to maternal and newborn deaths and poor outcomes there. So they then developed an advocacy campaign, and that included national and local government across health and nutrition, but also education, gender planning, a number of different UN partners, development partners, the NGO kind of technical leads, as well as civil society and young people were there from the outset again in developing the strategy, pulling together the evidence and so forth. But what they found at some point was, while there was a tremendous amount of consensus of the way forward, progress was plateauing, particularly on the investment side, on the resources that were needed. And so they kind of pivoted and put an even more intentional focus on the 3 Ps, people, press, and politicians, to really create that sense of urgency. And I think that's critical in our conversations about partnerships. You can have a tremendous amount of technical consensus, but where are we creating a sense of urgency, particularly to drive investment? So a variety of strategies were used for citizens to really voice their demands to political leaders and to co-create solutions through citizens' hearings and dialogues, petitions, massive involvement of the media, and huge engagement of youth mobilizers. In particular, the Girl Guides came on board and really recognized this issue as one of gender inequality and put a major focus of adolescent health into the efforts. They use the election cycle to push political parties to include addressing malnutrition in their party manifestos and political campaigns, with candidates hearing from hundreds of thousands in their constituencies that addressing this issue mattered to them and to their vote. All of the other partners continue to play their important respective roles, and in the end, the results were really impressive, including on the financing and education side. There's a 25% increase in the nutrition budget, then followed by a $60 million Government of Pakistan and World Bank nutrition initiative with all the elements of the campaign included, as well as adoption by the Ministry of Education of messages and curriculum in both secondary schools and medical institutions on nutrition. So I use that example because I think it's a good one both in terms of working across sectors, the catalytic role that civil society can play, but also that we can't get away of the inherent political nature of these issues, and that's critical for creating that sense of urgency.
Thank you very much. So the importance of mobilizing people. I know we're a bit short of time, but are we okay to take an extra 5 or 10 minutes, or is somebody else coming at 3 o'clock sharp? I'm looking at someone here. I think we can take 5 more minutes. So a few questions then, or comments on what you've heard both from the 2 last speakers. Any specific reflections? Are people tired after lunch, or you're just impressed?
Thank you. This is for the representative from the White Ribbon Alliance. How do you interact with the government, and how do you plan along with the government in alignment with the government?
Anything more? Yeah.
Hello? Hello? Can you hear me?
Aha. So then we have more there. We'll start here with the lady here.
Great. So it's wonderful to have this panel on partnerships. As far as the challenges you faced, bringing alignment, getting partners to really collaborate, pool resources, not duplicate and replicate and build trust, if you could comment on what strategies used for that for any of the panelists. Thank you.
One more question, comments from there?
My name is Felix Okam. I come from Calabar, Nigeria. Incidentally, my organization was part of the Saving Mother Giving Life initiative. And so I have a concern. The concern is that the private sector approach has a huge gap. And because the private sector is always interested in making profit. So our role as civil society organizations to generate demand for services. But you realize that when these women go to the private facilities, they are turned down on the ground that they don't have the money. The money is so huge. Now the question is, how do we empower this private sector in order that they will create access for pregnant women?
Thank you.
That is one.
Thank you.
Then,
so 3 quite big questions, so 3 short answers to those. I think Betsy, 2 of them, and then Claudia, the last one.
Sure. I'll just maybe take the question on planning with the government. I think one of the things I hear a lot is government is used just as kind of a monolith, and of course government's very complex, and are we talking about the technocrats within the government, or talking about political leaders? We have different ministries, parliament, etc. So I think in the example I gave, and often what we do, we work very, very closely with, for example, representatives within the Ministry of Health, Education, and Nutrition, as I said, but they were equally stuck on how to get the political buy-in that was needed from Parliament and Ministry of Finance. And so very much that partnership there, but then also working together to get some of that political commitment. And I think, as was also outlined in the examples given, of course, governments are made up of people, and it's identifying as well and working closely with those who are really championing something and want to partner and need the support of mobilizing that broad-based demand.
Thank you. Claudia, private sector challenge.
Answer the question about how we dealt with the fact that partners have many, many different bottom lines. And in partnerships, You know, we talk about the power of partnership, but we all understand that they are extremely high management burden efforts. And every partner, as the questioner said, may have a different bottom line. They may have different ideas of what success looks like. And I think one of the tips that I was going to share from the partnership qualitative study was the importance of having a strong and if you can do it, having an independent secretariat. It is absolutely critical that the secretariat be seen as an honest broker, that the environment that that secretariat works within has to be, as I like to say, we had 6 U.S. government agencies in our partnership, so I called myself an agency agnostic. It is absolutely critical that decisions be seen as fair, as transparent. We even went to the links of every quarter, having each of the partners talk about their contributions, actually send in their contributions towards their pledge. That was recorded and then fed back at the Leadership Council on a quarterly basis. So we tried to lay everything out on the table. If there were issues, we would try to work those out. I think the second main point is because...
I think we need to continue, sorry.
Okay. In terms of the private sector, I am so sorry, but it was very difficult for me to hear. I can talk about
then I suggest that we take that question offline when we are finished.
You wish.
Because I would like to continue with Preti, because I've got a question that I'm really interested in. I mean, you spoke about that you had 6 US agencies, and I suppose that was a bit of a challenge, but you have India, Preti. You have India, which is a huge country. So my question to you is then, and we have heard examples of this, going to scale. And how important and how are you working with partnerships in India to be able to go to this kind of scale? I heard something about 13,000 districts. I was working in Sierra Leone, we had 14.
So, primarily you're asking me that what are the issues and what are the solutions in scaling up partnerships. So, I'll club the two because they are interrelated. First and foremost is please define the framework, because there should be clarity on what partner is required to do what based on their strengths and based on their weaknesses. But along with defining the framework, please give them flexibility. And why I'm talking about flexibility is, I think Anuradha very importantly put it up for India, and I think it's true for the world, that ground conditions differ. One size doesn't fit all. So while you are actually defining your framework, but both in a policy, make the policy flexible. In action, you ensure that, adjustments are done. Because if you are saying 1 + 1 is just going to be 2, it's not going to be work. It can be 2.25 also. And our Honorable Minister was referring to the experience of Beti Bachao, Beti Padhao. And the secret behind it was, and she was mentioning it, that we made the framework very simple, we made it flexible, and actually the districts could do their own thing within that framework because conditions differed. So first is a defined framework, give flexibility. And next is that let the engagement be collaborative. You see, there will be some partners which will be more dominant, which will define the framework, which will have power to monitor, especially in governments, it happens. However, you have to be collaborative if you really want a true result. Let the partners speak up, because if you will close your ears and close other people's tongues, it won't work. So it has to be the listening and hearing, and the talking has to go on, so communication has to be kept open. Then provide resources. We may keep on talking about partnerships, but if we do not provide the resources that people need to work, then you see it's just like we heard such an effective presentation, a little play that was put up, and thank you so much for enacting it for us.